A few more seconds. Hey, and we're live. Welcome to Back Talks, everybody. This is Dr. Sean McWilliams. It's so great to have you here. One of the questions that a lot of parents ask me is, can kids, teenagers actually get herniated discs? Well, let's talk about that today, because I'm seeing it more and more, if you can believe it. Last year, I was taking care of a girl. She was 10 years old, had multiple herniated discs in her low back. Just had a recent patient as well, and seeing the same thing, and they're pretty bad depending on what kind of activities they're doing, and it's not normal. And I don't want these people to be debilitated. So let's talk about this for a second. So one of the things you got to understand is, what are we talking about when we have a disc herniation? Well, we're talking about this right here, is where we have these outer rings. If you've been with us, and hey, by the way, if you've been with us for a long time, welcome back. It's so great to have you here, part of our family. And if this is your first time, welcome to you. It's so nice to have you here. Hey, say hello in the chat. You can just do it, and if it doesn't, and I don't respond back to you, just refresh your browser again and set it again, and usually I'll get it. This technology doesn't always work perfectly when you're going live. So remember, so what we're talking about here is we're talking about the disc structure, which is this structure right here that sits in between almost every one of our vertebrae. You have these outer rings called the annular fibers. They're very strong. They're not designed to tear, but they can tear if they get dehydrated. And when they do tear, either from dehydration or a physical trauma or repetitive injury, what can happen is these fibers can tear through here. This jelly that sits in here, literally like jelly you'd make with a peanut butter and jelly sandwich, except actually runnier, more watery like, will push out of here, get squeezed out, and then what you're going to wind up having is a herniated disc like this, usually putting pressure on your spinal cord, this structure right here, spinal cord, or your nerve branches, either one. You're probably going to be in trouble most of the time. So let's look at an MRI so you can understand a little bit about what this looks like. So this is a side view of a person's low back. Their belly button would be up here. And then this line that you see right here is red, is actually, if you were to touch that, that would be the skin on your back. So this person's standing like I am, and we're looking through the side of their body. This is the one you're usually going to see on Facebook groups and stuff like that I see people are more comfortable looking at this image. It makes a little bit more sense to them versus the other view. But I want you to see a couple of things here. So this is your spinal cord right here, and then it goes down on what they call the cauda equina, which actually means the horse's tail. And you get these nerve fibers that branch off and run down. Those are called traversing nerve roots. Not that you really need to know that. This area from here to here is called the thecal sac, and why it's so white in all this area is because that's where your cerebral spinal fluid flows through. Okay, so pretty cool stuff there. Then what we get to is we get to the front of the bones, and we also look at the discs. So up here where you see D, that's for the disc, and I want you to look at the color of that. It should be a light gray to white looking color. And what I want you to start to notice is, I want you to compare this one up here where you see the D at, to this one right here where you see this D at, and I want you to look at the difference of this disc in here and look at the color of it. You can see that it's starting to turn black. When a disc starts to turn black on our MRI, it's called desiccation of the disc, and it means the disc is becoming dehydrated. So one of the big questions I always get is, well, does that mean that I'm just not drinking enough water? And it's a great question. The answer is part yes and part no. So obviously we need the raw materials to make sure that we have adequate hydration of water in our body to be able to get it into the disc. But what you also need is, you need to make sure that each bone, so the bone above and the bone below the disc, have their proper ability to move with each other. It's mandatory for proper hydration of the disc. And if they don't have proper motion, and one of the things that can cause that is traumas. So if you're playing football, wrestling, soccer, hitting balls off your head, things along that line, sports like that, those have a lot of micro and macro traumas to them. And one of the biggest things that you can start to see is the inability for the segments to move properly. And that's actually what pumps your water and your blood and your oxygen and your nutrition into your disc, and also pumps out the waste products. And when that mechanism starts to slow down, called imbibition, the disc will become dehydrated. You'll actually see it on an MRI, which I'll show you here in a second, of a young boy. And you start the process of degenerative disc disease and bulging disc and herniated disc as time goes on. So let's look at this guy right here. So here's a great example of what your disc should look like up in the upper part. So if you look at this disc that I've circled here in red, see the color of it? Okay, should be a light gray color. Same thing right here, light gray color to white. So when we look at what's called a T2 weighted image, we know that when those discs are bright colors like that, they're getting adequate blood supply and nutrition to them. This one looks pretty good. This one looks pretty good. And then all of a sudden we get down to these bottom two, the two most common ones to degenerate in the human body. See the color of this disc? See how it's turning black? And how we also see this material has come out of the disc and going into the spinal cord. We got a herniation there. And this is in a teenager. This should not be happening. All right. So you really got to watch the sports. You know, I always tell my parents, and then also as well, this one below, degeneration to that disc and dehydration. You know, that disc should be able to move and flex as your body moves. But if you lose that proper mobility inside and you don't get proper hydration, it's like having a rubber band that's been in your junk drawer for 2 years and you go to use it and you stretch it over something and bam, it snaps because it's getting dehydrated, right? Our disc can do the same thing, and we don't want that happening to your kids. So one of the biggest things when people say, what should I do? Well, first of all, you got to make sure you're hydrating. Half of your body weight in ounces of water per day is what you're going for. That's your goal. Half of your body weight in ounces of water per day. And please, please, please stop drinking your tap water and stop drinking the water coming out of your refrigerator. Those filters do not do a good enough job, because one of the biggest things besides bacteria and viruses and hormones that people take and urinate out, and it goes into our water system, prescription drugs from other people that get urinated out. Our municipalities cannot filter that stuff out properly, and it winds up back diluted into our drinking water. But one of the big ones right now is microplastics from all of the generation of plastic pieces of material breaking down. You get these microscopic plastic pieces that the municipalities cannot get out as well. It's becoming major health issues for our animals in our ocean, but also for us as well. You want to get that stuff out. You don't want drinking that. So reverse osmosis water is the way to go. You can buy those for a couple $100. You can have them installed in probably about 2 hours in your house, and you're going to be drinking probably about 97 to 99% pure water. It's the way to go. So that's going to be one of my tips. What else do you need to do? Doing preventative spinal hygiene with a traction unit to help start to make sure that you're helping your body restore this pumping mechanism back into the disc by tractioning the spine gently and then letting it go back. Can you do this with an inversion table? No, because it increases positive disc pressure in the disc, which is what we don't want. We want to create a negative disc pressure. Negative disc pressure is what's allowed that water and blood supply to get sucked back into the disc. Positive pressure pushes it back out. So, and we know from Harvard School of Medicine, they did a study on inversion tables. That's what they do. There are some benefits to them, so I don't want you to think I'm bashing on them. I'm not. But for a time and a place of rehydration in the disc, there's better pieces of equipment that you can use at home. And also disc nutrition. Collagen, vitamin D3, vitamin K2 helps retard calcification of the end plates of the discs, and also reduces inflammatory processes. Your omega-3s, those are going to be your big ones. Collagen is going to help rebuild cartilage, which the disc is mainly cartilage, so you want to be incorporating collagen into your diet. Vitamin D3, K2, and omega-3s. And that's going to make a big difference for you. If you're getting stuck in your life, if you have a teenager or a child that needs some help and they're dealing with pain in their back, you usually know it's a disc issue because they're going to start to getting sensations of numbness, tingling going down their arms, hands, or fingers, or down their buttocks, legs, or feet. As it progresses, usually people will start getting motor weakness. They just don't feel like they're as strong on one side as they used to be. Things along that line you're going to see as well. When it progresses even more, especially in the low back, you start seeing things like urinary changes, the inability to hold your pee properly. Maybe you pee way more often than you used to, getting discomfort, changes in bowel function, constipation, diarrhea. Things along that line you're going to start to see, and also weakness in your arms, hands, or fingers, or your legs, buttocks, and feet. That's usually when that stuff progresses even further because the nerves are dying over a period of time. You wanna get on top of that. But you can start seeing some pretty interesting symptoms though in kids. I've seen one last year, a 10-year-old girl. Seen another one here recently, and that's really important. So if you're not sure what to do and you're looking for a non-surgical, non-drug way to approach that, I ask get on my calendar, booking.drshawnmcwilliams.com. Happy to answer all your questions for you. We can talk about everything that's going on and help guide you. And if I think there's a good, natural, non-surgical, non-drug approach to helping your children feel better or yourself, want to help you do that. We can look at images if you have them as well. We'll spend some time on Zoom, and I'm happy to do that. I do a complimentary right now. I will not be always doing that, just so you know, because I'm getting busier and busier. But for right now, I still offer that complimentary for 20 to 30 minutes on me. And that's about $150 worth of service I give you just from the comfort and the goodness of my heart, because I want to help people and I enjoy what I love, and this is what I love doing. So that being said, make sure you get on my calendar, okay? I don't have a lot of slots, so don't wait. I hope this has added some value to your life today. If you know that you have someone suffering, you got a teenager that's dealing with this stuff, or somebody younger, and you're not sure what to do, set up a call with me. Let's chit chat about it for a little bit. Definitely, I'll guarantee I will shed some light on the situation for you, give you some direction. And if there's a product that perhaps we have that I think might really benefit them, would love to share that with you as well, if you're open to that. So great having everybody here today. Thanks so much for being here. As always, we'll see you next Wednesday. If you don't have questions, I appreciate you, and just realize that over 90% of most spinal conditions can be managed, believe it or not, from your home with the right guidance and the right tools. And that's why I do what I do. So yeah, say hello, leave me a DM, or even better, get on my calendar so we can have a real conversation and it can point you in the right direction. Share this, and if you love this, I hope you'll subscribe to my YouTube channel as well, if you think I've added some value to your life, and I hope you'll share this with other people that you love. And let us know what you think. I would love your comments, and if there's something you would like to know about when it comes to spinal health issues, would love to share that with you, and do some homework for you. I've hundreds and hundreds of slides I've made over the last 2 years. So would love to bring some light to a situation for you if you have a question. So great having you here. See you guys next week.